So choosing your solution and what you're going to do. The reason why you want to start an IV is because it's going to benefit the patient, right? So do they need fluids, or do they just need a lock or a INT, right? So you should be able to figure that out. Somebody has 3 bullet holes in their chest, they probably need what? Yeah, some ringers and saline hanging. If they are in congestive heart failure and they look like the Stay Puft Marshmallow guy, they probably don't need any fluid, right? But they need IV access. I'm going to tell you a little story about myself, and it's going to be recorded, so, you know, hopefully a person from many moons ago won't figure out what happened. But I ended up, one of my very first patients, I was on the truck by myself with, of course, an EMT partner. I'd been a medic for maybe a week. I was brand new, and I had a congestive heart failure patient. I was in bad shape. Started an IV, and this is back in the days where I had to call in for orders for everything. And we didn't have INTs. If we started something, it was an IV. So I asked for orders for an IV normal saline, nitroglycerin, and Lasix. Of course, they said, yeah. I started IV normal saline, and I was so excited and happy, I left that joker running. Gave him about 500 of saline.
Why would you want to give them saline and Lasix?
Well,
you take the water off with the Lasix and then you add it with.
That's what
I
he's
didn't
saying. You
want
left it
to.
running.
I left it on by accident. So if you have the ability to just start an INT, I would. The beautiful thing is, all my patients, whenever we came out with INTs, my method of operation is I start INTs on everybody. And then I just plug my IV into the INT. That's helpful for whenever you get to the hospital and the nurses have to take them out of their clothes and put them in a gown. Guess what? All you got to do?
Disconnect.
Just disconnect. But still, everything's there, right?
That's all we have on our trucks is INTs.
All right, so IV solutions are in sealed, sterile plastic bags. So those bags are sterile. Now, knowing that, can that bag be useful for other things? Let me just go ahead and tell you this. Those bags make very good occlusive dressings if you need it. Okay? So just if you've got that trauma patient with the 3 or 4 bullet holes in his chest, the little bitty wrappers of, that we typically use for occlusive dressings, which are what? We open up the petroleum gauze and use those, you can use the bags of your IV fluids as well. Same thing like if you have the eviscerated organs, you can use that as well. Just a little pointer out there. So they are sterile, and you want to look inside that outer bag, and if it's all dirty and stuff, well, guess what? Throw that bag of saline away. Don't use it. So like we said, our choices IV solutions are limited to normal saline and lactated ringers. And at the bottom of the bag, we have an access port, and we'll look over that. And these are some examples to look at. See, we've got 250 bags, 500 bags, and 1,000 bags. So that's a liter, half liter, and a quarter liter, right? Luckily for me, when my patient was in CHF, I only had a 500 bag hanging. So luckily I gave him Lasix, and when I got there, I was all scared to death. And the doctor said, "That's all right, we'll give him another 40 of Lasix." And he was. So administration sets. We typically have 2 types of administration sets on the truck. You have a 10-drop set, which is here, and a 60-drop set. Macro and macro and micro. Macro is the bigger, which would be your 10 drops. Micro is your 60-drop sets. So what this means is that it takes 10 drops to make 1 milliliter. In a 60-drop set, it takes 60 drops. So why would I want a 60-drop set and a 10-drop set? What's the benefit of having a 60-drop set?
For your medical and your trauma.
Some fluid.
Yeah, so let's say you have like a pediatric patient and you're wanting to only give a little bit of fluid to, right? Specific amounts of fluid to. You can calculate it out a little more exact. If your paramedic partners want to give a medication through that IV, the 60 drop set makes it a little more exact. The 10 drop set is more beneficial for trauma patients.
Get fluid on board.
Get it on, yeah, there you go. Now you can also, manufacturers out there also make fit there. You may see in the field 15 drop sets, 20 drop sets, and so on. But for the most part, EMS wise, we see 10 drop sets and 60 drop sets. So, like I said, you have the micro drip and the macro drip. And there's also a set called the blood set, and it's a special type of macro set, and it has the 2 ports here. One of them's for the blood hanging, the other's for the saline hanging. Now, we have used those. I've had, when I flew an Emory flight, sometimes we would use blood sets with just saline because you can get the blood to flow in, or the fluid to flow in even faster. You need a lot of fluid on fast per patient. So let's talk about assembling our equipment. Always use your BSI. And we're going to need your IV bag of fluid. You're going to need your drip set. You're going to need an IV. You're going to need tape. You're going to need some gauze. You may need a towel, depending on how much blood you let out. You're going to need a tourniquet. You're going to need something to swab or clean the site with. You need a sharps container. And you're going to need a tegaderm. And you're going to need something to secure the site in place. So, where this comes in, I know most of you've probably seen an IV set up. It's easier to work in a team. Have someone, have your partner help you if you can. A lot of us work in areas where there's volunteer firemen, and we've trained the volunteers, or we've trained the paid firemen how to help us do that. Let them do it while you're searching and looking for your site. Now, whenever you are setting up your IV, you want to make sure you look at the IV and use the 6 rights. Well, 5 out of 6 at this point, and eventually you'll use the 6th right. So you want to make sure there's no little floaties in there. Make sure it's in date. Make sure it's the right medication, which is very important. Whenever you set up your bag, and we'll show you how to do that, you want to make sure you get all the air out of the line. We don't want to give them a bolus of air. So choosing your IV site, man, look at all those veins on him.
I love that.
It's a lot of veins. That's good veins, isn't it? Mm-hmm. So whenever we're choosing a site, I see people, and I don't understand why, but they go straight right here. That's not what we really want to do, okay? Start down here lower, okay, and then work your way up. Let's think about this. If I start a line here, and I put a hole here, right? So, and then I come down here, and I start one here, and I start putting fluid in here, what's going to happen here?
It's going to start to leak out.
It'll leak out, yeah. And may infiltrate enough where it makes that where you can't use it. But if you start one down here, and it blows, right? Can you start one up here, above it? There you go. Try to start low and work your way up, okay? So, I have, like they're talking about track marks here, I had a drug addict once, had a bunch of little track marks up here. I started a line right here, and the fluid was pouring out up there. Bloody and stuff from the fluids I was trying to administer to her. It was bad. Watch out for valves. Now, our veins have little valves, and the valves, what they do is they prevent backflow. Because, you know, whenever the heart in between beats, right, there's a pause, And a pressure change will cause a little backflow to happen, right? And those valves close. And sometimes whenever you go to start an IV, you may end up putting the end of your catheter right at that valve. And if that happens, you may have, it may be what we call, you heard them say, hey, it's positional or whatever. Sometimes all you have to do is just back up the catheter a little bit and it'll flow good. Alright, so avoid areas where they cross over joints. So when you're starting this AC, here, it's not good to start it right in the middle of the joint. Usually what I do is, see this big one, I'll start like right here so that the catheter's right here. Because when it's in the joint, what happens when they bend the arm?
It occludes it.
Pinches it and closes it, which isn't good. So any extremity that shows signs of trauma, injury, or infection, we want to try to stay away from. Now this is not a definite, because sometimes the patients we go out on, that's all you got. You go out on a patient and they're burned over 80% of their body, well guess what? You got to start the IV where?
Wherever you can find the spot.
Where they're burned. All their extremities are broke, you got to start an IV somewhere, right? If it shows signs of edema, well you go out on a CHL patient and they got edema everywhere, you may have to. But you want to try to stay away from it if you can. And on the same side as a mastectomy, well if they had a double mastectomy, you may just have to do what you got to do, right?
Yeah.
But you want to try to, the best you can. This one is huge, okay? Try to stay, we do not start IVs on patients with dialysis fistulas, and we don't want to start IVs on that side, okay? Alright, so for patients in critical condition, we want to try to start an AC or higher. Now what we're talking about here, I'm going to go ahead and put this out here, critical condition. Alright, how many of the patients do you go out on who are truly in critical condition at that moment?
Not many.
Not many, right? But if you've got that guy that's shot 3 or 4 times in the chest, go for the AC. Reason being is because time is of essence. And where's the bigger vein at? Get the vein started, move on, get them, to the next thing. We don't want to mess around. In today's age, we now have drills. So if we're digging around looking and we can't find anything, just drill them. Now services are cringe at me. If there was somebody on the ambulance service back there, it'd be like, because guess how much those little needles cost? They're $80, $80 to $110 each. How much does an IV cost? A little over $1, $2 at the most, depending on the safety glides or whatever. If you work for a service that has gel codes, they're less than $1. Like 50, 60 cents each. So bulging veins can move from side to side, causing you to miss the vein. So look what they're doing here. They're pulling pressure back. We're pulling it what we call taunt. Holding it down, the more pressure, the pressure you pull, that helps hold this vein here in place. Because this vein will slide side to side. We call those rolling veins. And sometimes they're difficult to deal with. And I'm going to tell you, the back of the hand, you can have some good ones, but man, they hurt. But if that's what you got, that's what you should do.